I'm Peter Ndora. Welcome to this week's edition of Health Talk. Now, today is day 100 of South Africa's national lockdown and day 31 at level 3 in response to the COVID-19 global pandemic. So what's coming up on the program today? Well, we'll be joined by an anatomical pathologist to speak to us all about the testing protocols of COVID-19 and the current backlog of testing, and largely due to a lack of test kits to process the samples. We'll also be speaking to a psychiatrist and national public sector convener of the South African Society of Psychiatrists, all about mental health, mental illness and how to cope, particularly during the COVID-19 pandemic. That's all still to come, but first our senior producer Zama Buthelezi will take us through the latest South African COVID-19 numbers. Zama, thanks very much for joining us, always giving us these numbers. Welcome.
A very good morning to you, Peter, and our viewers. The number of COVID-19 infections is still gaining momentum in South Africa. In just 24 hours, the country has recorded 9,064 new infections and 108 more COVID-related deaths. Let's take a look at the national COVID-19 statistics. The country has tested 1,745,153 people. Positive cases, we're standing at 177,124. 86,298 people have recovered from the COVID-19 pandemic, but sadly 2,952 people have since passed on, and 87,874 active cases recorded so far. Taking a look at the provincial statistics, we look at how the infection numbers have grown significantly in just 7 days. This is just to show you how bad the situation is and why it is important to continue taking precautionary measures. The Western Cape was at 57,941, growing significantly, now standing at 66,936 in just 7 days. Gauteng at 31,344 last week. 7 days later, 54,331. The Eastern Cape was at 21,938, now standing at 32,157. Let's listen to the Gauteng COVID update and plans as presented by the province's Premier David Makhura and Health MEC Dr. Bandile Masuku as the pandemic is gaining momentum ahead of the projected peak in September.
We have to look at a number of interventions to help us weather the storm. Again, even those interventions will be informed by the advisory committee in terms of their full impact. We don't want to do something for dramatic purposes, but without achieving the results. But it is quite clear that we're going to have to do some of the things given where we are now that are essentially extraordinary, and some of them may mean asking the National Command Council to introduce some of the restrictions we have had in the earlier phases.
The beds that we are going to put up on field hospitals are close to 2,500 in different parts of the province. The Nasrec one is ongoing. It will be activated. There would be one that will be activated in Tshwane. There will also be one activated in Davidton, in Sinabe, in the East Rand, Ekurhuleni, and there will be one that will be activated around Midrand and Diepsloot area.
Let's continue with the provincial statistics. KwaZulu-Natal 7 days ago was at 7,090. We are now at 12,757. Northwest was at 3,218, and now we're at 5,168. The Free State province was at 1,069, and now at 2,130. While other people infected with the virus won't present any symptoms, COVID-19 symptoms include fever, coughing, sneezing, and shortness of breath. If you believe there is a chance you may be infected, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. As many people have returned to work and more learners going back to school, please take extra precaution by washing your hands with soap regularly, use sanitizers with 70% alcohol content, and wear a mask when leaving the house. Wash this mask with soap and water after use. Stay at home, and if you have to go out, observe social distancing all the time. This is just to make sure that we keep ourselves and others safe and healthy. Back to you, Peter.
Zama, thanks very much indeed. All right, so that's the statistics, but don't forget that as we observe and report on COVID-19 cases, the numbers can change, sometimes significantly, particularly you've been seeing this last week. Now, don't forget you can also be part of the show by asking our guests some of the questions that might be on your mind, or you could simply share your views on what we're discussing. And the number to call is 011, that's Johannesburg, 714 6841 or 6842. That's Johannesburg 714 6841 or 6842. Now, with COVID-19 testing rates and positive cases on the rise, communities are having a range of experiences. For instance, did you go for a private to a private facility or clinic or one of the publicly sponsored sites? How long did it take to get your results? Did you have to be retested? What kind of tests, and when did you get your results? How long did you have to wait before getting tested? Do you have symptoms, and did you have symptoms when you were tested? All of these questions, I guess, as some of you have probably had to mull over. Well, our question for the week is, what has been your experience with COVID-19 testing? You can send us your voice notes or video messages to our WhatsApp number, and that's 065 862 4548 065 862 4548. Try and keep your messages short, under 30 seconds, so we can share as many as possible. Don't forget you can also share your thoughts with us on social media via Twitter using @SABC Health Talk, #SABC Health Talk, or on our Facebook page, which is simply SABC Health Talk. All right, Health Talk continues right after this break. Stay with us.
Sinalanga ndifi Daniel Makwava from Shawela. So ndiko shoma security ndingapha awuchi that golo za SABC ziko dolugisiwa ndaba na interest yo ezithu zo ndi Generic radio ndingazwitisana then ndatangana na this guy over technician yawone SABC na yambutso no mfethu thomani ngazituku then ni doula ni swike somewhere. Today ndiko run an online radio station which is called Shawela Radio to make difference and to bring change ka community yasho.
We live in a new high-tech environment. Because of technology, some of the world's wealthiest people are tech entrepreneurs. Tech is how we play and how we work. For your tech conversation, join me, Pumelele Zondi, on Network every Sunday at 8:30 p.m.
Insofar as it makes it impossible for candidates to stand for political office without being members of political parties, the Electoral Act is unconstitutional.
With this judgment, I believe that we are put as South Africans on an equal footing.
What was started in 1994, there were pieces that were missing, and we believe that today some of those pieces have been put together.
Political parties must actually recognize this as a way of freeing themselves, because some of them got captured in the process.
What this means is that Parliament will have to find a mechanism to facilitate the participation by individual candidates in national and provincial elections.
As a commission, we stand ready to work with Parliament
Hello, welcome back. You're still watching Health Talk. Now, it's important to ensure that COVID-19 tests are available to those who need them. That's why the tests are reserved for those people whose doctors find that they meet the specific case criteria. Now, should you suspect that you might be infected and need to test, you'll need to be tested only if you meet the person under investigation criteria, which includes having symptoms of a respiratory illness or recent or sudden onset.
I went to the clinic. I was feeling fluish. I couldn't go to work because I was fluish. I went to clinic to get me checked out, and they told me I couldn't get checked out for coronavirus because they're a public facility. They only get 5 swabs a day. They're only gonna test people with serious symptoms. The symptoms doesn't always come with seriousness. What if I was sick and they didn't even let us get into the clinic? They let me wait outside and gave me my tablets outside for flu. That's all, and then I left.
Is to identify your symptoms. Common signs include fever, coughing, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. The second step is to phone the government COVID hotline or send a WhatsApp message. The National Institute for Communicable Diseases has 2 24-hour hotlines available. For people in the private healthcare sector, the third step is to consult a GP and obtain a referral to get a test. You'll be sent to your nearest testing center, and testing at private facilities costs from 950 upwards. Some medical aids only reimburse a member if the test is positive. Testing at a public healthcare facility is free, but first you have to call the COVID-19 hotline or send a WhatsApp message. You'll then be directed to the closest hospital where testing can be done. But you have to present flu-like symptoms and put on a face mask before entering the hospital. Testing results take 2 to 3 days. The final step is self-isolation in mild cases and quarantine in hospital in more severe cases. Self-isolation means limited contact with others, staying indoors unless medical assistance is needed. While quarantine takes place in a hospital, patients are isolated ideally in an airborne infection isolation room if available, or a ventilated single room. There's limited contact with healthcare workers.
Now, government and partners in the private sector are now collaborating to find COVID-19 test kits. There's a worrying backlog of test results, and stakeholders are now searching for a permanent solution. They're also increasing stringent guidelines for those eligible to test for the virus. And to help us understand what some of these protocols are around testing and factors contributing to the backlog, we're now joined by anatomical pathologist Dr. Nontobeko Mbata. Thanks so much indeed for joining us, and welcome to the program. Always good to have you on our show.
Hi, Peter. How are you?
Not too bad, actually. So, COVID-19 testing, and as the numbers have been ramping up, it's the backlog and getting these results out is taking that much longer now. Take us through some of the protocols in terms of who should get tested and who should be seen as a priority.
Okay. Peter, just to say before we go through all the protocols is that everybody should understand that this is not maybe governments or laboratories trying to be mean and not test everybody. It is mainly because we have the testing kits, we have limited resources or a limited number of cases can be done per day. So this is no strange concept in the medical field where things have to be triaged. So right now we kind of they try to just triage so that they don't miss the most important tests to be done. So it's no ways a manner of trying to refuse people to test, but it's just a manner of how do we use the limited resources that we have to at least try and make sure that we test do the most pertinent tests that we can do. So some of the, I've seen a few private labs that have released some of their protocols to try and curb or go around this this problem. And as you've mentioned, it's usually people under investigations which are your PUIs, and those people are the symptomatic people, especially if you have a history of contact. We also have to remember that the criteria kind of changes with time. Before, it used to be people who had traveled and had come in, but we've had the country locked down now for 100 days, so that has ceased to be one of the criteria currently. Then people like healthcare workers, people who are hospital inpatients, and people who are coming for admissions in hospitals, because you don't want to admit a person who's infected. Then, like we've said, symptomatic people and high-risk patients with comorbidities. These, from one lab, they've said these are the 5 criteria of the people that they're going to assist as almost their urgent cases or priority cases. Then they've listed another 5 cases, which patients who are COVID positive and requesting a retest, which we must remember is that even though they do, it is said that a patient can be positive after 14 days, but our national NICD regulation says that we don't need to retest. So we must remember that there's no need, and this is also based on the limited resources. The other thing is that privately in companies, some companies do request that their patients retest, but they usually foot the bill for it in private. So those are the criteria now that they're not going to treat as urgent. Then it's close and low risk contacts, requesting testing at less than 8 days after exposure. This is just to limit the number of tests where you can end up with false negative results. Also, low risk contacts, return to work screening for non-healthcare workers, and workplace prevalence screening. So these are the this is the criteria that they kind of pushing towards a bit on the side currently to try and prioritize the top 5 criteria.
All right. So just to get some clarity, I mean, if you've come into contact with somebody who tested positive, should you then just quarantine, and if you develop symptoms, then go to the next phase? If you don't develop symptoms, just do the quarantine, because chances are you will remain asymptomatic, and the 14 days, 21 days, whatever it is, then it's kind of out of your system anyway.
Yeah, so we must just remember the test at the time when you are either asymptomatic or not severely ill does not change the course of your management. So if you are tested and you are positive and you are asymptomatic or you have mild symptoms, the course of what you must do in terms of quarantine is then different. Obviously, if you have symptoms, there are some symptomatic relief therapies that are recommended, but in terms of isolation and quarantine, that remains. So testing too early will result in a false negative result, and you'll have someone who's in social settings or at work under the pretense that they are negative if they test too early. That's why one of the criteria is that if you've had a contact.
All right, Nontobeko, are you still there? Okay, it looks like she's freezing a little bit. I'm hoping that it's going to unfreeze, but don't forget, if you've got any questions, you can reach us on our number that I'm hoping we'll be able to put up on your screen just now, but 065 862 4548. We've also been asking you what your experience has been in terms of getting COVID-19 testing. I can tell you that I got tested a few weeks ago, and at that stage you could still just walk in and say, I'd like to do a test, and you pay your fee, and I got mine within 48 hours. But very soon afterwards I started to hear friends telling me that they'd gone to test, and they've started ramping up to try and limit the number of people testing, and then then you started to need a doctor's referral, and the tests were now taking much longer than 48 hours. In fact, let's go back to Nontobeko now and finish our conversation. Hi, Nontobeko. Thanks so much indeed. We had lost you for a couple of seconds there. One of the things that I am curious about is we hear about the different types of tests. I don't know if you can take us through those. Antibody, rapid testing. What are the different types of tests that are being done for COVID-19 specifically?
So the one recommended test that is done is the PCR, which is where they do a nasopharyngeal swab or a throat swab, and it is stored. It's like a long earbud looking type of thing, and it's stored in a specific medium, and that is then transported to the lab for a real-time PCR, which is where they look for the RNA virus. And that's the acceptable method of testing currently.
All right. I'm going to say, when I went to get tested, they put it down my nose, and that was a thing, man. And I hear that people also have it down their throat. Can you choose, or is it up to the person doing the testing? And do both give the same level of accuracy?
So they are both recommended, Peter. The NICD recommends both. I guess it's up to the people doing it. And we must remember, just as much as it's also uncomfortable for us to have it through the nose, it might also be uncomfortable for the healthcare worker doing it through the nose. So it could be a negotiated, maybe discussion between the person performing the test and the patient. And by the way, I've had both. I must say the one through the nose is a bit surprising because you can feel it almost down your throat. And then I've had the one in the mouth. I mean, in terms of choosing, I didn't really mind as long as it was within the recommendations of the NICD.
All right, just hang on for a moment, Nontobeko. Let's take the call from one of our listeners. Portia is on the line from Gauteng. Portia, thanks so much for joining us on Health Talk. What are your thoughts today?
Thank you, and thank you, SABC, for putting it all here. I have this concern, and as we are speaking about infection and hygiene, as we know that COVID is part of infection and hygiene, infection control and hygiene. So my concern here, I'm concerned about these prayer shops in the local areas, like in the townships. They are not practicing social distance, they're not wearing masks, and they're not even sanitizing people. So I'm so worried that many South Africans, they can fall into this infection because of carelessness. You know what I mean? So I wish it can be, maybe there can be some kind of enforcement with these prayer shops. As we know that, like Checkers shop, right, there are those enforcements of you are not entering without wearing masks, and then you are not entering without being sanitized, and then they are keeping on making people that they are keeping the queues, like the social distancing while they are waiting in the queue. But in this prayer shop, it's so amazing that you see this little children, you see the elderly, and then even with our people, because I believe in a way that people, they need more education. So some people, they are not in the level as you and I that we can understand what to do, what to, the hygiene matters, how to put place those hygiene matters. They need more education. So I plead that maybe if the radio stations, they can come up with a plan of people can come in and give out the talks about the infection control measures and the hygiene to our people with their languages so that they can understand. People are not wearing masks. Even full day in the prayer shop waiting and with these little children touching in their surfaces and understanding this virus, it lasts for 9 hours in the world. So can you imagine how many people are going to be infected in this period of time?
Portia, thank you so much. Very important call, and I think you raised some very important points there. And the point of wearing masks, actually, is that we protect each other. Rakesh, you're in KZN. Thanks so much indeed for joining us.
Morning, how are you?
Good morning, Rakesh. What are your thoughts this morning?
Okay, I actually have a complaint. Not really a complaint, something to find out about. On the 23rd, the National Health Organization did a test for me, right? And that test tested positive, but it came after 3 days. On the very next day, the 24th, I had a high fever, so I went to the hospital, and the hospital admitted me and did another test with the with Lancet Laboratory. That test came back negative within 24 hours period. So when I spent 4 days in hospital and was discharged, when I got home, I did a separate test again with Lancet Laboratory. That test tested negative as well. So now I've got 2 tests that say negative and 1 test that says positive. And bear in mind, the 2 tests are done within 24 hours.
Okay, all right. Let's put that to Nontobeko. Perhaps there's a solution to this. It is a complex story, but I just wonder what is happening, because I've also heard that when you retest even after 14 days, you might even still test positive, even though the COVID-19 may have left your body at that stage. So take us through some of the challenges of these tests, positive, negative. Rakesh says that he had 2 different results within 24 hours.
Okay, so Peter, like I said earlier on, is that especially, so we have 2 different scenarios. We have a test that has tested, that seems to have tested falsely positive if his subsequent tests were negative. And then there's a scenario of a false negative. And those 2 scenarios have 2 different reasons why they can occur. First, let me address the false negative test. If, Peter, if you have COVID-19 today and I meet with you and I get infected and I go and test and you tell me tomorrow that your test has turned out positive. If I go tomorrow, after only 1 day of being exposed to you, my test might come back as negative because I have tested too early. I always use an example of an HIV test. Remember, with an HIV test, which is also a virus, is that we usually say that there's a window period of 6 weeks where you have to wait, because during that time you could do the test and it could turn out negative. This is a similar concept. If the test is done too early, it might come back as a false negative. Okay, so that's what happens when it's a false negative. When it comes to a test that has become false positive, there may be other factors that are maybe beyond the scope of this discussion, but it is a thing that can happen. It could be a contamination in the lab. This does not mean that the lab is not accurate. These are just, remember that these are mechanical tests. There's a human being and there's a machine behind doing them. It, however, does not decrease the validity of the test. We still need to do the test, and yes, there can be occasional mistakes from either human error or machine error. Those things do happen. It happens with all tests. It happens with anything where there's a human, a person running a certain test. So this should not deter people into testing, and I understand it does come with a lot of anxiety to have a test that is positive and then subsequently become negative. I accept all of that, but these are occasional things that do happen with any test. It's not just the coronavirus test.
All right, okay. Nontobeko, we're going to have to leave it there. Always great talking to you. And I know that these are very complex matters. And I suppose if we keep it simple and just follow the protocols, wash your hands, sanitize them, sanitize surfaces, social distancing, and wear masks, then we should be fine.
Yes, Peter, and it'll prevent us from being exposed to people who are asymptomatic but positive. So all those factors we must still keep them in mind and stay at home as much as possible.
All right, Nontobeko, always a pleasure talking to you. Take care and stay safe.
You too, Peter. Thank you. Have a good day. Bye.
All right. Okay. You've been sending us some messages via WhatsApp as well, and let's take a look at some of those. And don't forget, when you do, please write your name in there so that we can acknowledge you. Let's see our few messages that have come through. So I went to test corona last week, Friday at Jubilee Hospital, but till now I didn't get my results. So last week Friday. So that's today's Saturday, so that's a week. My goodness. Okay. Morning. I must say that my experience with testing for COVID wasn't so bad. I opted to take a sample from my mouth. My throat was a bit irritated afterwards. I am still waiting though for my results from Kenelwe in Duduza. And this one is from Mutaung, who's in Velkom. It says, what are the benefits or breastfeeding facing COVID-19? Okay, so what are the benefits or not of breastfeeding during COVID-19? We'll try and get an answer for you on that one, actually. And this last one is people in the waiting queues for testing really need to realize that social distancing is still necessary and you must still wear your mask whilst waiting in the queue. You're absolutely right. I think as soon as you go outside, social distancing should be something you do all the time, no question. All right, let's hear your voice notes as well that you've been sending via WhatsApp. Let's start.
Hi, Peter. I took test on the 22nd of June and I'm still waiting for the results, and I was in contact with a person who's got COVID-19 and I need to know how long does the test take because I am still waiting. Monday is going to be 14 days. Thank you so much.
Good morning, everyone. My name is Ben. Regarding the coronavirus testing procedures and everything, I'm really having a problem because with the government institutions, surprisingly, your results get long, about 2 to 3 weeks, and with the private institutions, you get your results after like 2 to 3 days. And some other thing is, there's this conspiracy about these people from the private sector. When you go there to test, even if you don't have this coronavirus thing, your results will come back positive. I don't know for what, but it's something that has been going on around our communities.
So thanks very much indeed for your messages and your voice notes. You can also send us video notes as well. We'd love to see you, hear you, and read what your thoughts are. Now, Dr. Marlin Mackay is a general practitioner in Florida, in Johannesburg's West Rand, and has been seeing many cases of COVID-19 and every day gets questions around the virus. And this is one of the most commonly asked questions, and this is the answer.
If I have been exposed to the virus, get tested, and the results show negative, do I still have to quarantine? This is such an important point. Remember, if you get a phone call that says, listen, you were with me and I have tested positive, take the necessary steps, and we get the call. The most important thing about being in contact with someone who tested positive is quarantine. In other words, leave whatever you are doing, get home and be in quarantine. And you should know what quarantine means. For the next 14 days, you do not leave, you protect the others at home. Now, if you get sick, then you call your doctor and the doctor can arrange for you to have a COVID test. Do not, under any circumstances, leave to go to the doctor's place. Now remember, if the test comes back negative, it does not mean that you are safe to go out. All it means is that up until that point, you are still negative. You need to thus quarantine, just in case you may turn positive later on during the time of your quarantine. So the most important thing about exposure is not testing, is really quarantine for 14 days. Please, please don't forget that.
All right, so that's Dr. Marlin, a very important point there. Quarantining wearing masks and social distancing, critically important. So what we've been looking at today in particular is really the issue around testing and what your own experiences have been with this. And we're getting quite a lot of voice notes already saying that it's taking quite a long time, and there does seem to be a backlog that our testing laboratories are dealing with at the moment. So the question that we have for you this week is, what has been your experience with COVID-19 testing? You can send us your voice notes or video calls to us at 065 862 4548, 065 862 4548. You can also share your thoughts with us on social media using Twitter, and that's at SABC Health Talk or hashtag SABC Health Talk. Now, after the break, we speak to a psychiatrist and National Public Sector Convener of the South African Society of Psychiatrists, Dr. Kagiso Maurane.
If there's one thing that we have learned from COVID-19 is that we are all in this together.
With everyone being affected with COVID-19, as a show that brings hope and inspiration to the marginalized, the team decided to lead from the front in such trying times.
If you are doing the little bit that you can with what you have, you can let us know on social media. Just use the hashtag StoriesUntold SABC. Alternatively, catch up with our shows on YouTube. You can search for Stories Untold SABC.
Why is it important for the public to get involved in this discussion?
Virtually all municipalities are putting in bids to have their salaries increased. Councillors and municipalities around the country are oblivious to the fact that there's a pandemic out there that has created economic havoc in this country.
How does SALGA respond to that?
There is no municipal that has asked for an increase. We have then said to councillors, a council will sit, look at the gazette that has been provided, and it provides an upper limit of 4% for this current financial year for public representatives.
We're trying to say to the municipalities is get in touch with reality. You cannot simply sit back and say it's business as usual.
Many of our councillors have taken that, and we have seen how they have made a contribution by responding to the clarion call of the President.
Welcome back. You're still watching Health Talk. Now, according to the Mental Health Federation of South Africa, more than 17 million people in South Africa are dealing with depression, substance abuse, anxiety, bipolar disorder, and schizophrenia. Illnesses that rank at the top of the 5 mental health diagnoses. Now, this week, Health Talk senior producer Zama Budelezi spoke to Chantal Buesen, who's a young woman who was diagnosed with a mental health issue, mental illness, and is now advocating for those living with mental illness in South Africa and around the world.
Thank you so much for talking to us. We commemorating Mental Health Awareness Month. For you, what is the significance of commemorating mental illness?
There's a variety and a broad continuum of different types of mental agony that people are experiencing. So something like the Mental Health Awareness Month really just brings to light a focus on this and a focus on the impact, but also draw us to talk about this more and create a sense of awareness and signposting that there is support out there.
Which one are you living with, and when were you diagnosed?
I was diagnosed with bipolar 2 disorder about 5 years ago, and that came about due to various different reasons. Once you start learning about the illness, you realize that it is a very complex disorder, and it involves many different aspects that influences how your brain operates. And I think a big part of some of my advocacy around this and around specifically bipolar disorder is to make people aware that we have a very close tie to social issues and the way that influences our mental health and mental illness.
Was there anyone in the family who had been diagnosed with a mental illness, even if it was a totally different one compared to you?
My mother was diagnosed with bipolar disorder a couple of years prior to that. And also my uncle has been living with severe schizophrenia since the age of 19. And he has been institutionalized for a very long time. So when talking with my psychiatrist and having different discussions, and also me now working in this space, I have come to realize that there is a strong hereditary link. But even though that plays a role, that's certainly not the only thing that caused my mental illness.
Talk to me about the treatment that you received. Did it help you out? Was there any side effects? What happened?
I had to come to terms with the fact that it is a lifelong illness and that I also need to take medication every day. And there's a big controversy around medication. Some people don't want to take medication. However, it is for me and in my life, it's a choice that I make. It is giving me the ability to be stable and to think clearly and to have a sense of being. So that is kind of part of my daily routine. It didn't come without its ups and downs. The reality is it takes a long time to get the right balance of medication. I had some severe effects from certain medications, which was really devastating. It debilitated me in many different ways.
There's so much stigma around mental illness, and this doesn't just happen in South Africa, it's across the world. Did you experience any stigma?
Prior to my hospitalization, I was asked to sign a letter of resignation on the day I went to hospital. And I was obviously very ill. However, because I presented not ill, and I was told I didn't look like I had depression, I was told that I couldn't be depressed. So I essentially became unemployed because of that experience.
Chantal, talk to me about your advocacy and how people can get hold of you.
In terms of my advocacy, there's a great reach in terms of local, very hyper community-based implementation programs, being aware of what the global strategies are, where are some of the research are guiding towards, what are some of the new research coming out, and how we can apply it in our local setting. If you would like to get in contact with me, you can follow me on Twitter. It is Shani_Bird. It's CHANNY_Bird. Alternatively, I also have a Facebook page called the Empathy Hope Project, which is a traveling art exhibition that is focused on mental well-being.
Chantal, thank you so much for talking to us, and all the best with the amazing work that you're doing.
Okay, so the month of October has been declared Mental Health Awareness Month with the object of not only educating the public about mental health, but also help reduce the stigma and discrimination that people with mental illnesses are often subjected to. In South Africa, 1 in 3 people will have a mental health issue, yet 80% of people with a mental illness do not go and get treatment. The COVID-19 pandemic looks like it's also having an adverse effect on many patients with pre-existing mental illnesses. Well, to help us talk a little bit more about mental health and care, we're now joined by psychiatrist and national public sector convener of the South African Society of Psychiatrists, Dr. Kagiso Maruganye. Thanks so much indeed for joining us, and welcome to the program.
Thank you for inviting me, and I'm glad to be on the program.
All right, these are very difficult times that we're living through for people without any kind of mental health illnesses, but it does coincide with Mental Health Awareness Month, and one gets a sense that it's very important this year.
Yes, tremendously so. As you may have heard from various media outlets or various experts, we are quite concerned about the second pandemic, which is we fear that as the pandemic continues or prolongs, that a lot of people are going to become psychologically distressed because of the factors that are associated with the pandemic, and some of them may even develop psychiatric disorders, on top of the 1 in 3 chances of you having a mental illness that you just spoke about. So we're quite concerned about that, and we feel that this may be now an opportunity time to make people more aware of these of the emergent symptoms of psychological distress, and ask them to seek help early. Because if you wait too long to seek help, then one becomes a disorder, and sometimes it can become a severe and complicated disorder, which makes it quite difficult to manage with medication alone or just with counseling.
And I would imagine one of the challenges that you have often is trying to explain to people that mental illness is an illness, much like you might have a sore hand, a sore foot. Mental illness is very much the same and can be treated medically.
Yes, no, that is very true. I think the problem with the mental illness is the way that it presents. First of all, it can start off very slowly. So it can start while you're still quite a child or in your youth, and it may not be there all the time. So some people may hear a voice, but it's not there every day, it's intermittent. So they probably think that this is not a problem. Or some of them may feel that I'm not sleeping anymore, and they feel that, but everybody has got problems with sleeping, so I don't think this is a mental illness. Or they may get into a fight with someone and overreact and think, but it's natural. I mean, that person did do me wrong, I'm supposed to fight with them, only to realize that they're having fights with everybody out there, and even sometimes over mental issues. So the problem is that people don't know the set of symptoms and the duration of the symptoms that can say that you have a mental illness. And I think it's up to us to start teaching people that if you have this set of symptoms, then probably you have a mental illness, and then you need to seek help early. With other conditions, they know you've got pain, you've got headache, you've got a sore leg. It's very easy to kind of figure out what could be the problem, but not so with mental illness. So that's why the Mental Health Awareness Month becomes very, very important.
All right. So, I mean, there's a whole range of mental health challenges that people can face, and so we can't go through all of them, but typically what kind of markers do you look at that will say this is worth investigating?
Yes. Mental illness basically affects your thoughts, affects your moods, and affects your behavior. So when you look at thoughts, people start having ongoing feelings of being a failure, for example, or the feeling that people are against them, that people don't like them. Or sometimes in the case of bipolar patients, they feel that, they're extremely clever, they're extremely powerful. So these thoughts, these sort of unusual thoughts, if I could put it that way, may point out to mental illness. And when it comes to the emotions, then people are depressed. They feel sad, or they feel unhappy, or they feel down. And it goes on for more than 2 weeks, or they become extremely elated, and this goes on for more than a week, or they become anxious. They actually have a panic attack where they're afraid, they start having tremors, they start having difficulty breathing, and they start feeling maybe dizzy sometimes. So these are the moods that are unusual that may point out to mental illness. And when it comes to the behavior, you're withdrawing now, especially with children. You're no longer engaging with your friends, or you become aggressive, for example, or you no longer take care of yourself. You're not interested in going to work, or you're not interested in taking care of yourself. So all these various signs and symptoms can point out to mental illness, and if we have that, it's important for family to recognize it and say, don't you think you should see someone to deal with, to talk about these problems?
All right, so, this is a subject we can talk for hours and hours, but one of the common questions that often come up in terms of care, what's the difference between you, a medical doctor, a psychiatrist, and a psychologist in the scheme of helping someone get through mental health?
Yes. So obviously, a psychiatrist is someone who has done the 6 years of medical school training. So they are a doctor, and they chose to specialize, much like I could have chosen to become a surgeon or become a gynecologist. One chooses to become a psychiatrist. And the importance of that is that we recognize that mental illness is just not caused only by life circumstances. There could be medical reasons for a person to have a psychiatric problem. There could be substance abuse problems that could lead to mental illness. So it's important to have someone with some medical background to be able to exclude those, especially at the beginning, before they can just say that this is a mental illness. And then a psychologist is someone who is basically trained to lend support to this patient who's feeling distressed, who's feeling disconnected from the community, who's feeling isolated and almost belittling themselves and feeling that what's wrong with me, and then the psychologist is there to give them support and also change their mindset as well, or at least help them change their mindset so they don't feel like they're a failure, and also look at their behavior, to say that, you're behaving in this way in certain circumstances. Can we find a different way of behaving so we don't always cope in the same sort of primitive way or poor way when we come to distress. So we work together. A psychiatrist is not enough just to get someone over their mental illness. A psychologist is not enough to do that. We need to work together in order to get the best outcome for the patient.
All right, so we're going to be getting a number of calls coming through as we talk. So let's get one of those now. I think Camilla is on the line. Camilla, thanks so much for joining us. What are your thoughts, or do you have a question?
Hi, Peter, and thanks for calling me back. Yes, I do have a question. We always talk about our nurses and our doctors, etc., being the front line. And obviously they've got psychological issues. But my direct question is, what about our paramedics? Are they getting any kind of trauma counselling? Because they are really directly the front line. They're having to deal with cases on a daily basis, go home psychologically thinking, oh my goodness, could I be infecting my family? And I think to a large degree they're sort of being negated. Are they having any kind of trauma counselling is my question.
Okay, Camilla, thanks very much indeed. Dr. Marhanye, I think we've spoken to people before, and this is an important aspect now, isn't it, for people in healthcare. And these paramedics, they live in a high-pressure environment anyway, even before COVID-19.
Yes, no, definitely. Sometimes when I do see a patient who is already being admitted after maybe 3 or 4 days, and then they tell you what happened when the person was admitted, you start imagine the horror that the paramedic must have gone through. This person was violent, this person was probably spitting at them, this person was uncooperative, running away. So it must have been traumatic for the paramedics, and I do feel feel sorry for them that they have to experience these problems before we go in and contain the patient. So the trauma that they experience definitely is recognized. And I think with the pandemic and in previous pandemics, one of the groups of people who were most vulnerable are frontline workers, healthcare workers like paramedics. What we're trying to do in our district is that we're putting together debriefing sessions. So even those who go for testing or those who are in quarantine facilities, including paramedics, we're offering them debriefing sessions. But there's also a volunteer group that is linked to SASOP and linked to SADC called the Healthcare Workers Care Network. So this is very important. They've got a website and they are offering. They've got psychologists and psychiatrists who are offering pro bono work, free pro bono work to paramedics to sort of counsel them, and if they cannot be contained at that level, then they can be referred on to a psychiatrist. But lastly, it's very important for us to talk to the managers of these paramedics so that they don't feel that they can just send them into the front line and feel that nothing's going to happen. The manager needs to know that it can have an impact on them. They must see the signs and then they must refer the person on if they need the help.
COVID-19 has really put on the pressure, and I just wonder, are there things that you're now seeing in your practice that can be pointed to COVID-19? I know that us as the media don't help because we're giving you statistics every single day. The numbers are going up and the fatalities, and this, I'm sure, is adding to some of the anxiety.
No, certainly. I think just even people who are psychologically resilient or psychologically strong before the pandemic, it started to have an effect on everyone with anxiety, with the frustration, boredom, loneliness, and also depression, sadness, and even being traumatized. So this is happening with a lot of people. But more so for our patients with mental illness, their psychological resilience is not that great. And therefore, if we have this bit of stress, it just makes it worse. For example, bipolar patients, as the years go by, it takes just a little bit of stress for them to relapse. So we are concerned that is happening. I am seeing more people coming in, and what you're finding is that they're starting to use substances to cope. So that's how people normally cope, using alcohol,
Dr.
using drugs, and that's
I'm going to interrupt you because I just want to get this last caller in before we start wrapping up. And I think we've got, is it Neria in Cape Town?
Hello, Peter.
Yeah.
I was talking about the nurses, overall, the government was placing them in hotels to quarantine for the 14 days. And they were well looked after. But because you are in a single room and you're not supposed to come into contact with the other patients, you are so depressed later on in that room because your food is just put in front of your door.
Unfortunately, we've run out of time, but I'm hoping that we can get you on the line again next week. And Dr. Marhanya, thank you so much indeed for joining us as well. Thanks so much indeed for your time. Keep up the good fight there. And to you at home, sadly, we're going to have to leave it there, but please take care of each other, protect each other, wear a mask all the time when you leave the house. Take care. Have a great week, everybody. Stay safe.